And so really appreciate it. And our legislative task force co-chairs, Ash Hall and Arthur Simone. And so really appreciate your leadership. It has been a day of Zooms. I see a lot of familiar faces. You all look even 3 hours lovelier than you did 3 hours ago on the Doggett Zoom. So welcome back. Today we're going to be talking about the Texas legislature, and particularly what's going to be happening in the Texas House and different priorities. And so real quick, just wanted to say thank you and welcome. My name is Katie Naranjo. I am the chair of the Travis County Democratic Party, which means you are all my bosses. It is the best unpaid volunteer position ever, in which I am here to represent and do what I can to support the Democratic Party, to elect Democrats, but also to support and further progressive causes. One couple things I just wanted to note, if you joined us in the Senate panel on Thursday, some of this might be a little repetitive, but obviously in the last 5 days, the world has become a bit of a dumpster fire, at least in the United States, particularly near the area of Washington, D.C. And so a lot of things have transpired. It's been an emotional roller coaster. And so I hope, everyone's taking a break to sit with what's going on in our country, but it's not a surprise, and it's frankly not new. This is coming from an administration who from day one has been doing nothing but lying and dividing people across this country. And so our job as the Travis County Democratic Party is to unite people. And I have been approached a number of times by different Republican elected officials, Republican candidates, and the Republican Party to join a statement condemning what happened on Wednesday. And I'll be honest, I'm happy to join a statement with anyone who's willing to do one of three things. One, recognize the Republican Party has responsibility for being complicit in empowering Donald Trump. Two, that Donald Trump must be removed from office immediately. And three, that anybody objecting to the Electoral College certification, which represents we the people and our voices in the election process, also must be removed from office. Unfortunately, no Republican is willing to sign this. And until they do, we will not be joining them, because they have to take we have to hold them accountable, and they have to take responsibility for their part in Wednesday's events, and for frankly, the last 4 years. But we do look forward to unifying people, and there's a lot to be thankful for and happy about in 2021. First off, likely on January 19th, maybe January 22nd, the days it's not clear yet which day, but Senators Reverend Raphael Warnock and John Ossoff will be sworn in, giving us a majority in the U.S. Senate. And on January 20th, Joe Biden, Kamala Harris will be sworn in, making it a historic day in the country for the good and not for the bad. We at the Travis County Democratic Party are looking at opportunities to volunteer for our MLK Day work, which usually we have a great parade and a lot of fellowship. We are obviously not able to do that this year, but there's also going to be a National Day of Service attached to the inauguration, and we are working with the Biden transition team to support events in this area around that. Most of those events are obviously pandemic related events. And so all those who are able to participate and join are encouraged to do so. So as we look to unite, there's a lot of opportunity for us to unite in our party. Once the Republicans take responsibility for their stuff, we'll look at playing with them too. But until then, we're looking to unite around a new administration, new issues for us to be advocating for. And so the Texas legislature is really where we're going to be focused on for the next 6 months, probably 9 months with this special sessions, which I'm sure our representatives will be able to tell us about here in just a second. And so if you are interested in getting involved because you're fed up with what you've seen on your TV for the last 5 days, and or you want to contribute to moving the ball forward and not just distracted by Trump and his thugs, we have some great ways to get involved. First, you can join our legislative task force, which Ash and Arthur co-chair. And so you'll get to work with them. And one, they're really funny and they're really smart and insightful people. So I'm so excited for them and appreciative of their work. Second, we are organizing year-round in Travis County. We believe that the way to turn Texas into a Georgia is to engage people, listen to them in their communities, and understand what is important to them and work with them as a partner in lifting each other up. And so that's going to take a lot of time and effort. And so if you are interested in being a part of that, talking to your neighbors about what we can do to either make climate change a reality or a fact, or jobs or small businesses, whatever those issues are that you're interested in, we have some vacancies for precinct chairs that we are looking to fill. A precinct chair is a representative of the Democratic Party, and it's also someone who helps be an extension in the community to engage voters and then also give feedback to the party on what we need to be doing to engage the community. So we have some vacancies for precinct chairs. And then the third thing is you can join a Democratic club. We have some amazing Democratic clubs that are geographically affiliated, but also identity affiliated. And so however you are, whatever you're passionate about, whether it's about a specific area or specific LGBT rights, civil rights, you name it, we have some clubs available for you. And then last but not least, if you want to just dip your foot in and see what it's like, we do have volunteer opportunities to promote events like this. We're going to be doing a panel each month discussing different topics that are of interest and timely to the community. And so all of these opportunities are going to be dropped to you right now in the chat. You can click any of the links or send an email. And then what I've been doing, Ash and Arthur, if you see your emails from earlier today, I'm just forwarding everyone who's interested in being in the legislative task force and just kind of acting as your train conductor, if you will, for how to get involved in our buffet of options for the Democratic Party. So good news, we are here to get shit done, not to be distracted by the dipshits who attacked our Capitol. And I'm so excited to have Ash and Arthur kick this off for us to do that. And thank you all for joining us today.
Hey folks, thanks for being here with us today. Excited to see all of you on this snowy evening. My name is Ash Hall. My pronouns are they and them. I'm a precinct chair in Austin and also one of the co-chairs of the legislative task force for the party. I'll go ahead and let Arthur introduce himself.
My name is Arthur Simone. I've been a precinct chair since 2016 in 122, which is in East Austin. So as we get questions from people in our chat, please identify which House district that you reside in, just to help us steer your questions all the better. I have Representative Cheryl Cole. We're all looking forward to hearing about her agenda. Yeah, we have a lot of opportunity to help. And as Travis County Democrats and residents, we have that, mixed blessing / opportunity to affect change in a way that Democrats all over the state do not. So I kind of take it as a challenge to do as much as we can to affect the policy of, or lift the policies of our Central Texas delegation, both in the Senate and in the House. We've got some amazing people, and our agenda is their agenda. They are the shape that water takes, right? Or ice. But at any rate, we have a meeting on Wednesday for anyone interested in getting involved who isn't already. We can respond to a lot of specific questions and general questions about how the legislative process works and what we're hoping for from a volunteer task force. But we are going to be posting information galore in this chat channel. So stay tuned, and thank you for all being here instead of building snowmen. Back to you, Ash.
Great, thank you so much. I will go ahead and launch into getting some of these introductions and questions underway, starting with Representative Celia Israel. In her own words, she's a proud liberal, left-handed Latina lesbian, which is like one of my favorite alliterative phrases I have ever gotten to utter. She's represented House District 50 since 2014 and now serves as the vice chair of the House Democratic Caucus. So pretty fast ascent there. She's passed tons of bills aimed at improving our transportation, both in Austin and in the state of Texas. She's prevented homophobic bills from passing, all while championing voting rights for all Texans. And so that actually leads into my question, since Representative Israel, you serve as the vice chair of the House Elections Committee. Given all the ways that the pandemic has highlighted how flawed our system is, what kinds of bills do you predict are actually going to be prioritized this session around our elections? Like, do online voter registration and mail-in ballot expansion actually stand a chance?
I wish I could be more positive. I've been on the elections committee for 3 sessions now, and it's a tough assignment. For a number of reasons, but one of them is because it's the most partisan committee. So when I go before, my transportation committee and say, hey, I got this bill to support telecommuting, it gets out of the committee and it gets out of the House. But when I go to the elections committee and say, hey, I got this bill that would make it safer for voting and make voting more accurate, make the voting rolls more accurate, and it's more secure, it's called online voter registration. Their hackles go up. They act like I'm asking for so much, and it's a really difficult assignment. And that committee in particularly is heavily weighted with the majority, which is why I took one of the reasons why I took on the assignment of chairing the House PAC to flip the House, because it has been very difficult to get good legislation through that's not particularly partisan through the House. And as we've seen from Governor Abbott, they seem content with pandering to their base instead of being the governor and the lieutenant governor for all. And so I wish I could say that we would have some smart, thoughtful responses. But as we saw, like in Harris County, when they did the most Houston thing ever, which is drive-through voting, and then our state officials sued them. How dare they be creative and do efficient things at the county level? I doubt, for example, that a bill that would even make it explicitly permissive, because that was their argument when they went to the Supreme Court here in Texas, that you weren't allowed to. How dare you do creative things? So I'm anticipating roadblocks. Although 11 million Texans voted, and Democrats did much better than we had in the past. But it wasn't the end of Republican control as they had feared. When you let people vote, they did not lose their gavel. We maintained our number of House seats. So sorry to be a bummer right off the bat, Ash, but that's just a tough one for me. But if you ask me about transportation, maybe I'll be nicer.
I mean, feel free to give us a small preview of that before I can move on to the next question.
Well, on transportation, former Senator Kirk Watson and I worked really hard on a telecommuting bill. My staff tells me that I had a COVID package before it was COVID. Online voter registration makes a lot of sense from a safety perspective. And working from home is something we've all gotten used to, or many of us have anyway. So we'll be working again on telecommuting. It passed the House, it passed the Senate with a lot of help from Kirk Watson. And the governor vetoed it on the very last day that you could make decisions. It was, I was a freshman and I was like, right through the heart, dagger right through the heart. But there's, still 70,000 plus, more or less muscle memories, state employees here in Central Texas. And there's no law that says you can't do telecommuting, obviously, because they have been. But at state agencies, for those of you who are in or know friends who are within the state infrastructure, it always helps them when they get a bill from the legislature that is a permissive bill that says, we encourage you to do this. And so I expect testimony in the Appropriations Committee to help us validate how we've been able to conduct the people's business safely and securely, and perhaps show cost savings to the state as well. So we'll be working on that one again.
Awesome. Thank you so much, Rep. I'm going to move on now and introduce Representative Cheryl Cole. Are you on here, Representative Cole?
I see Vicky. I don't see Cheryl. There she is.
Hello. Good
Awesome.
afternoon.
Afternoon or evening at this point, I suppose, either one. For folks who don't know, Representative Cheryl Cole has served Austin in some capacity since 2006 as a city council member, then the mayor pro tem, and then as a state representative now. She's represented House District 46 since 2019 and hit the ground running. Did a lot to address protecting victims of cyberbullying, as well as equitable funding for public schools. Notably, she serves on the House Redistricting Committee, which is going to be a pretty big deal this session, if not in the special session. We'll see how that goes. I actually want to turn to an issue that doesn't get quite as much attention during the pandemic with you, and that would be criminal justice reform. Obviously, issues like healthcare, voting, education get a lot more spotlight given what we're going through, but I think you and I would agree that criminal justice reform has actually gotten more important and more vital over the course of the pandemic. Can you speak to that a little bit and tell us about some of your criminal justice reform bills?
Well, ever since the George Floyd catastrophe happened, the nation has paid much more attention to police encounters with civilians and what we're going to do to try and make it a better system. And I think that sentiment exists on both sides of the aisle to a certain degree. But I mean, I think the Republicans are open to hearing about it. I don't know how much change of policy they will absolutely do, because we don't see that when it comes to Austin and reimagining the police. But some of the things that are in the works are really stem from the George Floyd Act that Representative Symphonia Thompson is carrying this session, and that has been the focus of a lot of attention from the Black Caucus that I'm active with. That bill would ban chokeholds, as we know they should be banned. It focuses a lot on de-escalation policies and officers' responsibility to intervene when there is, an officer have put a suspect in a very difficult, precarious, life-threatening situation, and then to try to prevent it from ever getting to that point. The bill also focuses on trying to encourage the use of proper law enforcement based on the incident, especially for mental health, because we know a lot of these incidents stem from a telephone call to an officer or police force that really should involve some mentally trained officers. And criminal justice, man, it's just a tough one. There's just so much. Another big issue is qualified immunity. Basically, when people sue a government, they don't get to recover much because you always say qualified immunity, so everybody go home. We have the big trump card. So there's there's efforts to try to make that more agreeable or beneficial or potentially open to recoveries by plaintiffs when they make a case against the police department. So I don't know, that's the broad array of things that's going on with criminal justice. I think it will get some limelight because of all the demonstrations and even our recent march on the Capitol assault that just happened will make protests and police interactions with people a lot more under the spotlight.
Oh, sorry.
Thank you so much.
If I may, I would like to speak a little bit more about that. I know that a lot of people don't know me. My name is Linda Nuno. And what it really needs to change in Austin is Article 143, which allows the contract of police to be revised by the city council. I have a long history of brutalization, torture that involves my daughter and I. we have been systematically brutalized by a police element officer here in Austin. And the amount of corruption is just completely unheard of. Now, my baby is in the custody of this police officer who has been abusing her for 5 years. The problem with that is that the biological father of my child is a Republican judge. And this just tells you how much the Republican Party is willing to go in order to save face. It doesn't matter if it's a pedophile or a rapist. I really, really, really want to get involved with the Democratic, because it's the only way to get justice, real social justice. Thank you for your time.
I appreciate the comments.
Yeah, thank you very much. And yeah, part of what we're trying to accomplish with this task force is the chance for people in our city to also go ahead and connect with our representatives and work together to forge solutions so that people are not suffering under these systems. That's a big part of what we're about. So you're in the right place. I'm going to go ahead and turn it over to Arthur for the next set of questions. Thank you again, Representative.
Thank you. Nice to talk with you.
Hello, Representative. From Precinct 122, we send our regards and our congratulations on your reelection. We will have a lot of time for questions, hopefully. So if you have questions that you want to direct towards the elected officials, please just drop them in the chat. Drop a link there if you have a story related. And likewise, our representatives will be able to put in their contact information, all of their office members. And there are so many different and amazing people that work for our elected officials that have their own policy columns. So we want to be able to connect you guys to one another. But I want to move on because the circus is crazy. The tensions across the country are just crazy right now. So it helps to just focus inwards and keep politics local and talk about, the things that most, life goes on. We have to talk about the business community. We have to talk about schools. And so to talk maybe a little bit about schools is Representative Hinojosa here in the room? I'm not sure I see her, but I'll go ahead and introduce her. She's a native Texan. She's product of public schools. She's a champion of labor, former board of Austin Independent School District. She is starting her third term as state representative for the Heart of Austin in HT 47. Representative Gina Hinojosa, please.
Well, thank you. So I just chatted. My connection is not good, and I called AT&T, and they said, there's a pandemic, so we can't help you, but try these things. So it remains bad. But this is life right now, right? We're all having to make do in a 2021 that has been a far cry from what our hopes were for it so far, I'll say. But yes, the work must continue, and it's correct that I do focus on education issues. It is the case that during this pandemic, our children and our families have really struggled. And I just will not mince words and say that there has been a lack of transparency and consistency coming from the state, and really compassion coming from our state when it comes to our schools. Beginning with schools not knowing whether or not they had the even legal ability to close. That was a fight that continued for a while at the end of last school year. And now in a position where we are in a position right now where Dr. Mark Escott, who heads up our coronavirus response at Austin Public Health, has recommended that high schools and middle schools be closed and that no school operate at more than 25%. However, the Texas Education Agency has decided, and this is just based on no legislation, law. It's just the commissioners decided he has the authority to withhold funding from our schools should they go 100% remote, even in response to the advice from our public health authority. So our schools are in a tough spot, and they shouldn't have to be in this position. So we're looking at legislation now that would change the way we fund our schools. We know that schools are begging just to not lose money for this next semester because enrollment's down, attendance is down. I mean, people's lives are chaotic. And so we're looking at doing this a different way and making sure that schools get credit for when they do need to go 100% remote. Another issue that has emerged is the state's insistence that our kids take these STAR tests during a pandemic. I think everybody needs to understand that the majority of our kids in Texas public schools are minority and low income, and this pandemic has hurt these families more severely, has impacted them more terribly, if you can believe it, than many of us, when families don't have health insurance to rely upon, when they have people have pre-existing conditions, as in the case of many low-income minority families, when parents are losing jobs. I mean, the list goes on, making this an extremely challenging and emotionally and mentally hard thing for our kids to go through. And I think we lose sight of that when we are making education policy. So I have a bill that says that the commissioner must ask for a waiver from the federal government from having to take the STAR test in cases when there is a disaster declared by the governor and schools. Kids can't be in schools because of that related disaster. So we'll be working on that. I do believe there is strong bipartisan support for something like that. And then, you know, the challenge has been, we are all so focused on daily on what's happening with this pandemic that there hasn't been a lot of time to look forward about what should happen. I know the Travis County delegation, we all spend so much of our time just getting information from the state about our COVID response. And right now with the vaccine, it just seems a daily struggle to get information about these things. And so I'm not going to lie when I say it's meant that preparing for this session has been much harder. And I wish there were more time, but here we are. So we'll keep working. We're not done with our legislative agenda when it comes to schools. I'll have my bills from last session where we're trying to exempt schools like Rosedale, where kids are have severe disabilities to the extent that many are nonverbal, and yet teachers have to chase them down with the STAR test to prove that it's not appropriate for them to take the STAR test. To exempt schools like that from having to take the STAR test. And again, I'll continue with my bills on charter schools that would not allow them to discriminate from admitting kids who have disciplinary records, even as minor as going to the principal, which we know charter schools are able to do, and some of the larger ones and others do have policies that do that. So, so we'll keep at it. We're working with, I'd love to hear from you. I talked to some teachers last week, got some ideas from some teachers, and we're continuing to meet with education advocates to understand what needs to happen when we get back to some kind of normal for our schools. And I don't know how much time I have, but I'm going to stop right there and just check.
Stopping you.
What's that?
I'm stopping you. That's great. That is a great transition because Thank you, Representative Jeannie Hinojosa.
My
Have
pleasure.
a great transition, an easy transition over to our next State House Representative, Vicki Goodwin, who is actually the 47th. I had said 47th earlier, but Gina is in 49th, I believe. And we had a couple of people ask, and I'll answer that one of our representatives, Eddie Rodriguez, is not able to make it today, but we will be joined eventually by Representative Donna Howard. But I did want to talk about Vicki Goodwin and get her into the conversation. She's a small business owner, a real estate broker, a community leader. She graduated from UT, the LBJ School of Public Affairs. She just won a really tough re-election, and I want to congratulate her on that. And I think a lot of what got her reelected was that she was one of the co-authors of HB3. And so that could give us a nice transition to talking about the state of Texas schools. I know I have some Medicaid and other questions regarding that, and we can start fielding questions later. But there's a lot going on, but at the same time, we have to soldier forward. We have to worry about our children's schools, and we're kind of in the dark here. So if you want to speak about what you're working on, I'd love to hand that over to Representative Vicki Goodwin.
All right, well, thank you. Of course, I would agree that the families in House District 47 are incredibly proud of their schools and very supportive of public education. And of course, we're happy that House Bill 3 passed this session. Making sure that we maintain the promise of the increased funding is going to be a big deal. You know, our budget is going to be a really tough thing to pass with all the priorities and all the needs that are out there right now, and the decrease in revenues. So one of the things that I'm doing, it combines several things. You know, our environment is so important too. And something that's come to my attention is during COVID, the increased amount of flaring that the oil companies have done. It did decrease for a period of time because fewer people were driving, and so a lot less oil was being pulled out of the ground. But the Railroad Commission at the same time has loosened some of the regulations around the environment during COVID. And so anyway, I plan to file a bill that would put a tax on gas that's flared or vented, just like we do on the oil that's pulled out of the ground. Right now, we don't tax the gas that's being vented and flared. So it would be a disincentive for the companies to continue doing that. And in the short term, it would be a revenue source. So we definitely need to have some revenue sources at a point in time like now. I'm also working on some bills on gun regulation. So tightening the background check system, and also a bill on charter schools to make sure that we have a level playing field and we have more transparency about when they are trying to open additional schools.
Thank you, Representative. So one of the questions that we get a lot in the Legislative Committee is why there are so many different versions of so many different bills, and how you guys go about picking which ones to co-sponsor and which ones to reach across the aisle on. And we're talking about sources of funding, and we have all of this money that is owed the state in Medicaid that we've paid already into. And so a lot of people are wondering, how can we get this passed this session? Do we have more of a 50-50 chance of passing it this session, and how? I've heard about a couple of state referendum bills that are in the works for Medicaid expansion, but also the Healthy Texas program that Gina has a hand in. So I'd love to hear your take on that and open it up to some crosstalk.
Yeah, I mean, I think if there's a time that we're going to pass Medicaid expansion, now would be it. We have so many people that need healthcare that for a variety of reasons aren't able to access it. If they've lost their employment, they may have lost their employer-based health insurance. So now is definitely the time to make sure people do have the ability to go see a primary care doctor. It's just that that wording, the Medicaid expansion, has been so difficult for us to get through the Republican Party. So I think it's very smart to transition to some new language around it, such as the Texas Healthy, what is it? The Texas Healthy, say that again.
I believe it's the Healthy Texas program.
Okay, the Healthy Texas program. Thank you. You know, if we can work on things like increasing the kids who are under CHIP, or the women who have given birth, expand that time frame that they're covered from the 60 days to a full year, working at it by chipping away different populations and making sure that they're covered. I think that is a better way to get buy-in from the Republicans, as opposed to saying Medicaid expansion when that's really what we're doing.
Awesome. Thank you so much. I do believe I saw Representative Howard enter the room. Are you there, Rep?
Mute myself. There I go. Okay, I couldn't unmute myself. Yes. I'm here.
Awesome, awesome. All right, I'm going to introduce you real quick and then get to your question.
Okay.
My goodness. So Donna Howard has served House District 48 since 2006, and in my opinion, has gone on to become one of the most consequential legislators in the entire House. She serves on the Appropriations Committee, so she has a direct hand in the state's budget. She's the vice chair for the House Administration Committee, and she's been on the Higher Education Committee for a pretty long time now. Most recently, she authored and passed a bill creating the Sexual Assault Survivors Task Force in the governor's office to collect information on agencies' responses to sexual assaults and develop best practices. So Representative, you filed a slew of just fantastically feminist bills this session already, ranging from ending the tampon tax to preventing workplace violence in healthcare facilities and more. I think it's easy for us to see why these bills are important, especially during the pandemic, especially given the job losses that women in particular have faced in the last year and the way there's going to be financial strain there. I wouldn't be surprised if a number of your colleagues perhaps didn't make that connection. So my question for you is, what should first-time advocates both know and do to help you get some of these bills passed?
Well, thank you, Ash. Yeah, there's definitely been disproportionate impacts on women during COVID. And further, of course, disproportionate impacts on women of color, whether it be through COVID or the maternal morbidity and mortality issue that we've been dealing with for quite a while now. I have been made chair of the House Women's Health Caucus, and that's giving me an opportunity to work with a lot of my colleagues to make sure we have legislation that is going to take into account the needs of those who are seeking women's health services. And we're also trying to be more inclusive there too, and make sure that we recognize that there are people who seek women's health services that may identify differently. And we want to make sure that we have those services available and that we're being inclusive in how we're advocating for these things. So we've expanded the depth and breadth of the Women's Health Caucus. For a long time now, it's been really focused on the abortion issue, and certainly that's going to be coming up again this session. There's no doubt about it. But we wanted to be much more expansive in how we were looking at those kinds of bills and programs and policies that we need to have in place that really tie in to women's health care in particular. So a few have been mentioned already, but certainly some of the legislation that I have is to bring Texas into what basically every other state in this country is doing, and that is providing reimbursement for contraceptives for the youth that are on the CHIP program. Now, it seems pretty common sense, but we are basically the only state that doesn't do that. We got it through the House last time. It got stalled in the Senate with the deadlines, and we didn't get it over the threshold, but we hope to do that this time. You mentioned the tampon tax. This, again, is a regressive tax. You know, in the greater scheme of things, it's not a huge amount of money, but when you are making $7.25 an hour, and when you are trying to pay rent and utilities and get food on your table, buying a box of tampons is probably the least on your list. And yet you need these. This is a medical necessity. This is not a luxury item. It should not be taxed. And there are many other states in this country that have taken the sales tax away from feminine hygiene products. And the United Kingdom has just done that. Scotland's gone even further, and they're actually providing feminine hygiene products at no cost to their citizens who need them. We need to go that direction too, because I'll tell you, this is really, and COVID has exacerbated this, disproportionately impacting women who are in our lower socioeconomic cohorts, that they have to decide how they're going to spend the limited dollars they have. And what they end up doing is not using any product and not going to school because of that, or reusing products or using them for a longer period of time and subjecting themselves to potential health risks. So this is just ridiculous. It's a discriminatory tax, and we need to get rid of it. We've had bipartisan support for that in the past. We actually got a hearing last session and had some dynamic young women come and talk about this and testify in support of this. Girl Scouts from the Plano area who came down. But there's many menstrual equity programs in place right now, people who are really picking up on this. And so I'm really excited about the advocacy possibilities there. Vicki mentioned what we need to be doing about Medicaid expansion, and certainly there are some very specific things we're looking at with women's health care. And she mentioned in particular expanding from 2 months postpartum to a full year postpartum to get Medicaid coverage. You know, over half of the births in Texas are to Medicaid patients. And yet we kick the moms off of the Medicaid rolls 2 months after they deliver those babies, even though a large number of the deaths and certainly the morbidities occur for a full year postpartum. So we, at a very minimum, need to be expanding Medicaid to cover that. And then I guess one of the other things I will mention is the reinstatement of whatever it's going to be called, but the Office of Minority Health Statistics. It's also been called the Center for the Elimination of Disparities and Disproportionalities. Lots of names here. Bottom line is, we need to be addressing the disproportionate impacts on Texans of color in the healthcare arena, but also in many other arenas that we are involved with as state government, but particularly in healthcare. And I would posture that if we had had that in place, we could have averted some of the problems we've had with COVID, because we would have had somebody at the table anticipating the vaccine deserts that we have in communities of color and in our rural communities, which is why this week, Austin Public Health, with the additional doses that they've gotten for some mass vaccinations, they're going to be going into basically the eastern crescent of Travis County to some of these healthcare deserts and make sure that they set up some pop-up areas where they can get vaccines to people who have not been able to access it, and some of our most vulnerable people in our community. So there's probably a lot more I could talk about. I don't even know how much time I was supposed to talk. So I'll stop there, and y'all can tell us if you want us to say more, or we're answering questions, whatever you want to do. Thank you.
Thank you, Representative Howard. I would love for the ability to unmute Representatives Israel and Cheryl and Vicki. I don't know if they have that ability right now to speak with and to one another about what you are expecting as public servants at a time when the Capitol is going to be very inaccessible to a lot of people. I think that a lot of folks here want to affect change and they want to make phone calls and write letters to the editor, but they also want to provide their testimony directly to the committees and to the representatives themselves. Do you have any advice for folks who are wanting to get that done this session when it's such a unique set of circumstances?
Well,
We have-
go ahead, go Cheryl.
Oh, I was going to say, we have not been specifically told yet on how we're going to handle public testimony for the committee hearings or just for that process. I mean, I guess the biggest news is stay tuned. We adopt our rules on Tuesday, and we'll kind of be going through a lot of reiterations of that Tuesday and Wednesday. But I anticipate that there will always be invited testimony, but free public testimony. We'll just have to see how that's going to pan out.
Yeah, the unfortunate timing of this, of course, with Austin and the surrounding area being at the highest risk level, and unfortunately looking like things may get even worse, it's going to be hard to figure out how we can safely have public testimony in person at the Capitol. That being said, we want to be able to put something in place that ensures that the public does have input to the process. It's how we're going to make that happen. And as Cheryl mentioned, we'll be adopting temporary rules on Tuesday when we get sworn in. And then we'll spend the next several days trying to craft whatever the rules of operations are going to be that will allow us to have virtual testimony and whatever needs to be done. You know, we've been hogtied over this interim because our rules didn't allow us to meet virtually. We've had no meetings and no hearings. It's been ridiculous. This is the time when we're supposed to be, you know, doing our homework, checking out what the budget's going to be like, being able to provide oversight to how the CARES dollars are being spent by the governor. He's been in control of everything. We've had no opportunities to provide the kind of oversight that we would normally be able to do. Anyway, that being said, I like Cheryl says, we don't know yet. We've got to figure out what we can do that keeps people safe, but also makes our deliberations transparent and make sure that Texans have opportunities to participate, because that's the only way that this is going to work. We've got to have citizen participation. So we're going to be working on that and trying to figure that out. And hopefully we'll know something within the next week.
Could we go back to talking? Is Representative Gina still available? Is she still here? Gina Hinojosa? I would love to know. She's unable to connect. Okay. We have a great comment here from Linda. We absolutely need to include mental health in the Healthy Texas and/or Medicaid expansion program. People who have serious mental illnesses are short-cycled through the psychiatric hospitals and released often no better than when they entered. They are released to homelessness. Texas needs to step down supervised housing to stop the revolving door to jails, homelessness, and hospitals. The newly designed ASH, the hospital which is being built, will have no new beds, even though the current waiting lists are long. Have any of y'all been working on that? And would you like to speak a little bit more about our path towards accepting Medicaid expansion money in the state of Texas?
Celia, you should talk about yours.
Yeah, well, I'll talk about Medicaid expansion, and then Donna is not just the senior Democrat on the Appropriations Committee. She's the senior member on the Appropriations Committee, and I know she has been tracking the progress of the ASH facility. But last session, I filed a bill inspired by the conservative state known as Utah, which expanded their Medicaid based on the voters saying, yeah, more of my fellow Utahns should have health care. Since then, of course, we had the pandemic. More and more of our Texans have lost access to health care because they were, maybe they were in the service sector, and their job was their connection to healthcare. So I filed again the same exact bill, but it's a different environment now. So it's House Bill 389, and the HJR that goes along with it is 23. Since we've met, the most recent state to do this is another very conservative state, Missouri. So I'm just calling this the Missouri model. If Missouri can do it, Texas can. And polls have showed that Texans do support the expansion of Medicaid. Let's take back our state dollars and do good things with it. I will also say one of our former colleagues, who I admired from a distance when I was not in the legislature, but Dr. Zerwas is an anesthesiologist from Houston, and he introduced the Texas version, the Medicaid expansion bill himself several years ago. And as we know, for political purposes, Texas chose to look the other way on doing the right thing. And Dr. Zerwas has come back into the fold, and I believe as an advisor, perhaps a staffer, I'm unclear, in and around Governor Abbott. And in the last election, healthcare was a big damn deal again, as you can imagine. And I'll remind us that 2 years ago, after the last election, we had a record turnout, and the last legislature produced $6 million in cash and lots of upgrades and bells and whistles to support public education. So elections do have consequences. 11 million Texans voted in November. And the buzz is that the Republicans are working on a healthcare expansion program. Of course, as Democrats, we've been clamoring for that for generations now. So, we'll see what we can hammer out, but I'll let Rep. Howard talk about it from an appropriations perspective.
Well, there's probably a lot of things to say from appropriations perspective here, but clearly the Medicaid expansion has a price tag to it, even though we're talking about a 9-to-1 match from the federal government with dollars that we have paid in our income taxes. That being said, I know that what was formerly known as the Center for Public Policy Priorities is now known as Every Texan, that organization has done some analysis and determined that the cost savings of getting those that fall into the gap right now, getting them healthcare coverage, getting them a medical home, the cost savings of not using our emergency rooms, of treating conditions before they become more costly, that there's an actual, obviously, eventually it would take a period of time, but a cost savings that could be viewed here. There's also talk about maybe using some of the local tax dollars that are currently paying for healthcare services and help those cover this expansion. But be that as it may, there is a lot of bipartisan discussion. People there, our Republican colleagues are afraid of calling it Medicaid expansion. So as Celia said, they're finding any other way to frame this. What I've heard another group call it is leveraging federal dollars, whatever. But the fact is that these are Texans dollars that have been sent to the federal government that we have left on the table, estimates of $100 billion that we've left on the table, maybe even more at this point in time, that we could probably bring down $10 billion to our state. And with a 9-to-1 match, we're talking about maybe $1 billion or so that we'd have to find. That's a lot of money. But when you're talking about a 2-year, $250 billion budget, we ought to be able to find space for investing in what would give us a huge match and would help support the healthcare of Texans. And I would argue too that, especially with the pandemic exacerbating things, if we don't spend enough money to invest in the healthcare of Texans, in the education and the workforce needs of our state, then we're not going to be able to get people back to work and get this economy going. We've got to do those things. It's not the time to cut back. It's the time to invest in Texans. That is the path to recovery.
All right. Thank you so much, Representative. We have maybe time for 2 questions before we need to start wrapping up and let everyone get back to the Saints playoff game that I'm sure they're losing right now without my help. Do you have a question you want to ask, Ash?
Miracles can happen, Arthur, apparently, like snow in Texas and the Saints winning.
I know a question I've been getting a lot, especially since the insurrection in DC, has been more to do with your safety as representatives, as well as the safety of folks who may visit the Capitol. I guess the best way I can think to phrase it is, are y'all going to be okay? How's the situation at the Texas Capitol shaping up? Is there anything that we should know as your constituents and as people who may at some point set appointments to visit you?
Well, I was at the Capitol on Wednesday when the insurrection was going on in Washington, and they came by and they put us on lockdown pretty quick. And they didn't say, you have to evacuate the building or anything like that, but they did put us on lockdown, which means that no one could come into or out of, and you want to have your badge secure at that point. There was demonstrators on the South Lawn that were, Trump supporters, but it wasn't, I guess, any different than we normally have when something else goes on. And I just think the attitude in Texas is so pro safety security that they would not want anything to happen to us, especially given what happened in Washington. So I think they are probably doing, and probably already were having, major security protocols even before the Washington incident. I don't feel in any greater sense of harm from protesters than I mostly have anxiety about how we're going to handle COVID breakout, which is very different.
Well, I'd like Rep. Goodwin to speak. She and I last session served on the Homeland Security and Public Safety Committee, which is where we had the gun zealots testifying, and we're already getting emails with them expressing their interest in this. But Rep. Goodwin, you have a unique angle on this. I will say, we've all gotten used to operating remotely and listening remotely and providing feedback remotely, and we'll continue to do that. My staff will be, we adopted telecommuting policies early on, and now with more vigor, and we will be safe. And DPS is more of a presence now than they have been that I've seen, and we'll be watching. But
before you talk any more about that, let me just remind y'all that Celia and Kirk Watson had legislation to allow, not mandate, but allow state agencies to develop telecommuting capabilities for their staff. This was way before COVID, and the governor vetoed it. And here we are now actually doing what they were trying to put in place. They were very prescient. It's unfortunate that it was vetoed. We've been forced into doing it anyway, but I want to make sure y'all know that and know what good work Celia was doing all along for the telecommuting, since you just mentioned that.
Thanks, Donna. Everyone knows I want to be the queen of Texas, and that's not happening. So we'll keep trying.
I love the deskmate on deskmate support right now.
We always got each other's back.
Let's take in one more question and then do a wrap up. I think we're eager to learn more about the budget shortfall and how that impacts public schools and higher education. Is there any more to be done in terms of filing more legislation, or do we just razor focus in on one or two and go with that.
In terms of the budget shortfall, you know, we're going to hear from the comptroller tomorrow about what his revenue estimate is for the next 2-year cycle. And until we know that, it's going to be kind of hard to know what we're working with. The current budget that we're in, the current 2-year budget, you know, he revised a surplus down to a $4.6 billion deficit shortfall, but he has also said that he doesn't think it's going to be as bad as he originally thought. We don't have those final numbers either. So bottom line is, things may look a little better than we thought. It's still gonna. Oop, I don't know what I did there. Okay. I'll let somebody else talk.
I'll talk and remind everyone that in the comments you can see links to how to contact and get involved in the Travis County Democratic Party to become a precinct chair and to get involved in the legislative committee. No, you do not have to be a precinct chair. We just want to know what district you're from here in Travis County. We also want to, yeah, there we go. And I want to remind you that there is another Zoom meeting on Wednesday wherein we'll try to digest some of the big information that's coming down the pipe when the legislature gavels in. So between the comptroller report tomorrow and gaveling in on Tuesday and the rules being established, there are going to be a lot of things that we can talk about. And with that, Asher, you good? Yeah.
Did any of the other reps want to comment on the budget? Sorry. I didn't know if any of the other reps wanted to comment on that question since it affects all of them. Sorry.
I've been saying that one of our big goals is going to be to, of course, a robust George Floyd Act, in my view, is really important. We're in the midst of another civil rights era that we should not that we need to be attentive to and responsive to. As Rep. Howard mentioned, the deficit is real. The answers are difficult, but I think there is going to be broad support to say let's not go backwards on the $6 billion that we put into public ed. And if you recall, after the last recession, we cut public education by $5.4 billion, which was proved to be the exact wrong thing that you should do. We need to support our future economic vitality potential. So watch everytexan.org, other good progressive organizations, and thank you all for your activism and for your interest. And we've got the best damn delegation in the state of Texas.
Did you just boom yourself? Okay. Just wanted to note that. I hope that's how you end all your floor speeches, by the way, with a boom. I think we're good to wrap up. Arthur, I saw some comments from the other reps that they had finished their comments. So.
Okay, well, with that said, a lot of great questions in the chat and information to share around. There is the email to contact Asher I in regarding the legislative task force. If you have no experience with the legislature, if you have all of the experience with the legislature, we'd love to find a place for you once we know a little bit more about what the session is going to look like. But until then, drive safe and go Saints, and good luck this week, state of Texas and the entire country. What can you do?
Special thanks to Cindy for helping to put the panel together and the staff of the different representatives for all the work that they do, and for Brian to make sure that we are able to communicate and all Zoom together. Thank you all. Have a great evening. Thank you, Arthur. Thank you, Ash. And thank you, representatives.